Welcome to the Ashraf Garda show.
Our thought leader chat today is really fascinating because it deals with stats and numbers and models, in particular around COVID-19 in South Africa, maybe around the world as well, and what that really means. My guest is Dr. Ridhwaan Suliman. Ridhwaan, good chatting to you first up, and welcome to the show.
Good morning, Ashraf. Thank you for having me.
Thank you. Now, I have to tell you that I was first alerted to the work that you do at CSIR and beyond, thanks to Twitter, because you decided to start tweeting around some important stats around COVID-19, right? Maybe take us back. What prompted you? Because that's not your day job, right? What prompted you to start analyzing and providing that information to all of us?
Sure. So I found that we received the raw daily numbers, the COVID-19 numbers and statistics, but those raw numbers in isolation weren't providing a complete story, for me at least. And so I started tracking that in my own personal capacity and visuals to get a better understanding of the trend in the data, both nationally as well as provincially, but also then to understand how we're doing and to compare with other places and other countries.
Okay, so in fact,
I find that a graphic visual.
In fact, what you're saying is you answered your own problem. That means you wanted more, and the only way you could get more is to create your own graphs, right?
Exactly. I did have capacity to understand for myself what's happening. Of course, the COVID-19 is a global pandemic. It affects us all. And so I decided to share these graphs and the data and analysis on Twitter for those that are interested. I believe that it's a global issue and it's something of use to all of us. And so sharing that was my way of helping to understand the situation and contributing, adding some.
Okay, and the point made, I mean, that's not what you do every single day. You are based at the CSIR, what's it, the Center for Scientific Research, right? What is it that you do there?
Yes, so I'm a senior researcher at the Council for Scientific and Industrial Research. I have a background in engineering and applied mathematics. And what I do on a daily basis is work on projects that involve the mathematical modeling of physical systems and trying to use computers and software to understand what's happening in the world around us. So what we do is we take various physics problems and try to understand what the physics is behind that. Excuse me. So we take physics problems, understanding what's behind that, and using mathematical equations that describe those physics, turning those mathematical equations into programs and simulations to then understand how these systems behave. So I work in the area of computational mechanics. Essentially what that entails is we try to understand how physical systems behave. Equations that describe these problems and turning them using programs into simulations and models. Examples of this include how air flows, how fluid flows around us. Some of the projects that I've been involved in have looked at the way aircrafts move in flight. What you have is a solid body, the aircraft, that's air around it. And that is a continuously changing system, and we can use the mathematical equations to describe the flow over the actual aircraft and to understand, to answer questions such as how they're fluttering and how can we design these systems more efficiently and more economically. Other examples include looking at blood flowing through our own bodies. What we've got there is, again, a fluid medium moving within arteries and a solid body that's deforming, and answering questions such as how does that movement occur? How do things like heart valves behave in a system like this? Those are the type of problems that we try to answer.
Okay, so that's what you
in this
normally do.
domain
So
of
then when you decided
mechanics.
to answer your own queries around the data around COVID-19, and when you went public with it, so one thing is internalizing it, and then when you started tweeting under, so Ridhwaan, and the number is, so Ridhwaan is a 1, Ridhwaan tweets, right? I mean, from my side, you are not what I would come across for me as an Twitter activist. That means I don't see yourself as having a Twitter profile, and yet suddenly in the space of just over a month, right, that all changed. So did you question yourself to say, like, the possible impact it's going to make, not just in terms of the people using it, but therefore the impact on yourself?
To be honest, I didn't really think about it that much. I was not very active on Twitter prior to sharing the COVID-19 data and statistics. I decided to just share it because I was doing these graphics and visuals in my own personal capacity to understand some of the questions that I've been asking myself. And I felt that since this affects us all, there may be others interested in this. And so I decided to share this on my profile for anyone that has been interested. It has gained some interest and a fair bit of traction. And I think that points to the usefulness of the data and the visuals that I do share. I think the other point to note is that we're living in very uncertain times. There's a lot of fear, there's a lot of uncertainty, and there's a lot that's unknown during this time. And there's also a lot of conspiracy theories that have come up along the way. And I think it's important to make and the scientific measures to understand exactly what's going on, to alleviate those fears and those uncertainties, and to add information to help understand why some of these conspiracy theories are about. So I think sharing the data in an unbiased and open and honest view, I think, goes a long way in helping us to cope with the current situation.
I mean, this
which we are
point
living
you
in, which
and
is
I'm quoting others, so paraphrasing.
as we know.
You can't implement what you can't measure. I mean, and in the space that you're in, I'm taking it you're going to say thumbs up to that. You absolutely have to measure things before you actually form opinions and apply that in terms of what happens next, isn't it?
Absolutely. I think we do need to make use of specific data and measures and use the scientific understanding. Important. I think it's also important to have independent bodies and independent parties looking at the data from different viewpoints so that we can gain confidence and gain an understanding into some of the decisions
Now,
and why these
we'll talk about the
decisions
stats
have
itself
been made.
in terms of the numbers in a moment, right? As per your tweets, at which moment did you get it that, oh my goodness, this is making a broader impact? People are hearing and following me, and they're latching on to what I have to say because what I have to share is important to them. Was there a particular moment?
To be honest, I don't think there's been a moment. I don't really think about it too much. Of course, what I'm doing is just taking the daily numbers and turning them into graphics, analysis, and visuals daily as we receive those numbers. Because the time frames are so short, because there's continuous pressure to do this every day. I've not really sat back and thought about the broader picture, rather just focused on individually what I can do, what's important to show and to share. Along the way, there has been interest and there has been being asked, but what I try to do is to continue on a daily basis, just trying to track the data and show an unbiased and scientific view of
compared
what
to,
is going
say,
on.
mid-June, which is probably the first time I heard about you. Besides your regular tweets, you've been on radio, you've been on television, you've been quoted extensively. I certainly know that, and many other people following the whole COVID experience in the media space, in fact, are quoting you extensively. So the impact is certainly there. I'm going to suggest you being rather modest, saying I can't think of a day when I realized it all changed. But I mean, here's the point. The expectation now for you to deliver every day is there, because I remember once tweeting you like, "Where's your information tonight?" And you'd be like, "I'm too busy at this point in time." So once you start it, people expect, isn't it?
So I've been tracking the data and sharing daily updates and visuals every day for 5 months now, almost every day, in fact. And the few days that I have missed out on sharing the data, a lot of questions and expectation as to why I missed out on a few days here and there. So, of course, to point out that I've been sharing this in my personal capacity, and there are time constraints as well as challenges in the timing that we receive the data, as well as the type of data that we receive. And so the sharing of this data has sort of grown into its own type of it's sort of a baby that's developed now and requires attention and others to continue doing so. And
Yeah, and I take it you can only
at the same
stop when
time too.
COVID stops. So we'll see what happens there, right? Let's then get into the data that you actually provide for us, right? So what is it that you were not receiving or understanding besides the raw facts that were given out in terms of how many infections that you then have now analyzed and provided for us? What was missing? What are you doing?
So what we are provided for, and I think we should be very grateful for the numbers that we do receive on a daily basis. Those numbers include the number of confirmed COVID-19 cases, the number of tests conducted, the recoveries, deaths, both at national and provincial level. And I think the government and the country has done really well thus far in informing us of the situation and how it's going on. In my particular case, I found that the numbers in isolation weren't telling a complete story. I found that we need to track the trends in each of those measures to understand where we're going. Absolute numbers on a particular day don't really mean unless understanding the historical trends behind it. And so, firstly, I started just tracking all these particular measures and just understanding how they evolving over time, both nationally and provincially, because we've seen that the infection and the numbers do vary too. So after doing that for a little while, I found that there's certain other measures that have become important to show, and with numbers and evaluating the data and statistics, what we're seeing is a lot of numbers and statistics on a daily basis, and it's difficult to understand what's important and how can we understand what's going on based on that. I'm fairly comfortable using those numbers, and so I've started looking at quite critical at this stage, things such as test positivity rates, things such as the doubling rates to quantify the trajectories of cases and deaths. And I think these and other measures have become important.
So for you, what are probably the 4 or 5 most significant things that you track daily and provide for us that you think just absolutely we need to be following?
Sure. I think there are a few certain measures which I've been providing on a daily basis, which I think are quite critical. Important measure is the test positivity rate. That is a measure of on a daily basis, it's the number of new cases as a percentage of new tests. Where we're at and how we will be able to manage the pandemic, the test positivity rate, both at national and provincial levels, to understand where we're going.
Okay, maybe let's talk about that one. So I mean, how is that positivity rate change, which my understanding either as a percentage or how many people test to get one positive person, right? How has that changed over this period?
Testing is a critical measure to understand how we're dealing with the virus. It's an important tool to combat the virus. And it's one of testing allows us to get ahead of the curve with quick turnaround times together with efficient contact tracking and tracing. The infection rate is spreading and evolving. And to do that, you need to measure or you need to test sufficiently and extensively. We make use of the test positivity rate, the number of cases as a percentage of tests, to get an understanding of the extent as well as the timing thereof, because it's important to also test as the scale of the outbreak is increasing, to ramp up the testing as the scale of the outbreak as well. And so the test positivity rate tells us if we're testing sufficiently and tells us whether we have the virus under control. That particular measure in South Africa, it started just soon after lockdown. We were seeing test positivity rates below 5%. Of course, that is dependent on the number of tests conducted too. That number increased as 19 cases surged, and that particular measure went all the way up to 28, 29% at some point. What that means, in other words, is at 25%, you have what you're seeing, test positivity rate of 25% indicates that you're finding a positive case for every 4 tests that are conducted, which means you're not testing sufficiently, which implies that there are many undetected cases that are going unreported. Drive that test positivity rate down much lower, so that we have a better understanding of how many actual COVID-19.
Okay, so right
infections
now, what's
currently
August
on.
13th, and I'm going to say 2020 because you never know what happens down the line. That positivity rate dropped, I think, to 17%, and you've always been talking about it needs to get below 20. So at 17, it's now no more 1 in 4. It's almost like what, 1 in 6, if I'm not mistaken, or maybe even more. Your sense of that?
So it's important that that particular measure that you mentioned today of 17%, so that is the daily for the last 24-hour cycle. These particular measures do vary. Look rather at a 7-day average. At the moment, it's around 22%. So still looking at a positive case for every 4 to 5 tests conducted. That being said, the steadied from highs of around 28%, declining over the last 2 to 3 weeks, which gives us some confidence that the rate of infection is not spreading as quickly as it was 2 to 3 weeks.
So that's a critical one. What are the other barometers or graphs that you've turned out?
I think another particular measure that's critical to follow is the doubling rates. We've seen government the rate of growth of infection in terms of doubling rates too. And this measure isn't really shown daily, or this particular measure.
Yeah, carry on. Yeah, this measure, carry on. Yeah. Or maybe starting with doubling rate. Yeah.
The doubling rate.
Yeah, go ahead.
Important measure is the doubling rates and the doubling rate of cases as well as deaths. We do understand that the numbers do increase exponentially, and how do we quantify and understand how these numbers are changing? The doubling rate is a useful measure that allows us to quantify these trajectories, and essentially just tells us how quickly these numbers are doubling. Rather than looking at absolute numbers or percentages, we quantify this into days. So what I've been showing as part of the daily updates is the doubling rate of COVID-19 cases on a daily basis, as well. I've also been tracking the doubling rate of deaths. Now, if you look at it, allows us to see how the rate of growth of infection has been evolving over time, and we can look at that particular time during each of the lockdown levels, and use that measure to see as another indicator how we're coping with the COVID-19.
Okay, so give me an example of that. I remember around the time that I was confirmed as COVID positive, July 1, and maybe in that week thereafter, when the numbers were certainly surging, you put on there the doubling rate is like virtually as 15 days. So 15 days, the number that we see on a given day would double. As per, again, August 13th, that number is like 170 days. So help us understand that.
Yes. So during the month of June and early July, as the number of COVID-19 cases was spreading rapidly in the populous province of Gauteng, the surge in numbers could be quantified by the doubling rate. And at least during lockdown level 4 nationally, the doubling rate of cases was every 14 to 15 days. Essentially what that means is the number of cases that we're finding is doubling every 2 weeks, which is very fast. And we saw how quickly those numbers increased. What we're seeing of late over the last 3 weeks or so is a bend in the curve, and we're seeing a decrease in the number of cases that are confirmed, and that particular doubling rate has slowed down. So one can look at that measure on a daily basis, and as you say, over the last 24 hours, that particular doubling rate is over 150 days, which is good. If we look at that particular measure over the last 2 to 3 weeks, it's close to 45 days. So a significant difference from what we were seeing back in early June, where the numbers were doubling every 2. You have to bear in mind that all of these measures do have limitations, and the number of confirmed cases are limited by the number of tests.
Yeah, I want to pick up on those tests in a moment. Let's talk about the doubling rate of deaths then. How has that changed?
So if you look at if you look during the different lockdown levels, during lockdown level 4, the number of deaths were doubling every 11 days. That has slowed a bit to 17 days during the early parts of lockdown level 3. And over the last 2 weeks, a bit more to doubling every 22 days. This is useful so the number of deaths is useful in its own right. Of course, it's a critical number that we track of. We also know that the deaths do lag the cases, and that lag is about every 3. That lag is about 3 weeks to a month of confirmed cases. We are seeing that the number of deaths, hopefully now with the decrease in cases, the deaths will soon follow that trajectory and decline.
Okay, so then, and then I'm trying to see if you've done this, sir. Have you put out a graph around the number of hospital daily or weekly hospital cases, or the doubling rate of that, either hospital or ICU?
I was showing the number of hospitalizations. It's another critical measure. For a while I was using of course, all of the data that I use is publicly available data. I was using these reports to track the hospitalizations. I stopped doing that, and the sole reason for that was I found that because not all hospitals report to that particular surveillance, it wasn't the the actual hospitalizations. That being said, I think it's still a critically important. We want to take measures to ensure that our hospitals are not overwhelmed, to ensure that our health, and ultimately that's the best that we can do, ensure that people have the best access to hospitals and to healthcare. And so, yes, hospitalizations are critical, together with comparing with the capacities that we have in the different
Okay.
regions.
How much currency do you then give to the recovery rate?
I think the recovery rate is important, and the recent upsurge that we're seeing in the number of recoveries is good news indeed. It's important to point out, though, that we're not testing for recoveries at this stage. I believe due to prioritizing testing for critical cases, from my understanding, is we're tracking the number of days since a confirmed case is either not showing any symptoms or is no longer in health. That being said, I think it is still important to keep track of those recoveries. And I think those recoveries are showing the right trends. We saw a surge in numbers 4 to 6 weeks ago. So naturally, the surge will follow. And it's important to keep track of.
Yeah, absolutely.
Of
Now, is there anything
news.
else that you measure?
So I keep track of the cases, the tests, the number of recoveries, the active cases, all of that sort of. In addition, the test positivity rates, the doubling rates that we mentioned, percentage increases in various measures. I think that's an array of things. Those are essentially the measures to keep track of. What's important then is how do we make use of those measures? What do we show with those measures? And one can simply show those numbers in graphic form on a daily basis, but one can also compare things such as the tests, which that particular, it's a phase space plot, which tells us the extent of the testing as well as the timing thereof. And I think keeping track of that as well as comparing daily cases versus total cases, as well as daily deaths versus total deaths, in graphic things that are happening and going on at the moment.
Okay, and of course you also provide it at provincial level, which I think is a given in terms of understanding the explanation. I want to go to the issue of testing in terms of confirmation and unconfirmed right now. I remember probably just a week, in fact, before I got infected, Professor Shabir Mahdi from WITS made the point at that stage. He says, I'm telling you that if we're saying there's 100,000 people confirmed, my estimate is there's 1 million people infected in South Africa at that point in time. Now, that is like over a month or two ago. That would have changed dramatically. Considering we don't have those numbers of people who are not testing but potentially positive, does that not throw all this data out of the window, keeping in mind that you, for example, said you didn't want to provide the hospital testing because you were not getting input from all the hospitals?
That we are tracking, and there are nuances as well. So the number of confirmed cases are limited by the number of tests that we do conduct. The testing numbers are subjected to either capacity constraints or to backlogs. The number of deaths that we do pick up are subject to various reporting measures, and possibly could be undercounted in some cases. Exactly what is COVID-19 related or what other factors are at play. So it's important to point out all of the limitations to all of the measures. And when you point that out, you're still able to understand the importance of those measures, bearing those in mind. So if you look particularly at the number of confirmed cases, as mentioned, um, and the number that we're seeing currently, well over 500,000 confirmed cases, it's not a true reflection of the actual number of COVID-19 infections in South Africa. And that can be confirmed by looking at the test positivity rate, which on average has been around 25% for the last 3 to 4 weeks at least. That means that you're finding a positive case for every 4 tests conducted. Understand those limitations. But even with those limitations, I think you can still gain important and crucial information and understanding from
So statistically,
data.
Continue.
Crucial understanding. One gains important understanding, both crucially from a statistical point of view, what the trends are and how they are.
And I mean, and that point about statistics. So with all the limitations, with all the limitations, I mean, that's the best we have right now, right?
If we focus particularly on the testing, I think yes. I think it's important to keep note or keep in mind the limitations, but then understand that this is what we work with, and using that, how much information and how much understanding can we extract from this, and that's why looking at the trends in all of these measures becomes critical, because that limitation remains throughout. And looking at the trend, you can see how it's changing, and that gives you an understanding of how the various measures are evolving and the implications.
And I take it, I mean, that issue of trends, which is more long-term as opposed to daily, with limitations, would be something that many other countries would apply as well. So they would still base it on the same type of data analysis that you would be doing, right?
Absolutely, and it's important to point out that we're not alone in our limitations and our constraints. These are constraints and limitations that other countries have as well, and that they are forced to deal with. And so there's a bigger picture as well. We're not only looking at how COVID-19 is tracking in South Africa and at provincial level. We look compares to countries around the world. What can we learn from all of those countries? I think South Africa has been fortunate in that we've the infection has spread at a slightly later time period to some of the other countries. We know it started in China, moved to European countries, the US, etc. And so we can learn a lot from the statistics, the data, and different treatment measures and things from countries globally. And how can we use that and use our data that we have to try and find any correlations, and to compare how these numbers compare with those countries across the world. It's important. Yeah.
So somebody made the point just a few days ago that, with South Africa being such a divided country based upon economic wealth, in terms of our Gini coefficient, it would be worthwhile to look at the same statistics based upon that wealth, upon that divide. So maybe the simplest way would be those that get tested and therefore end up in private hospitals versus those that end up in public hospitals. Do you provide that data? Is that missing?
I don't provide that data in my capacity. I think it would tell quite a story if one looks at the public versus the private testing and the numbers thereof. I think it's important. Unfortunately, it's not something that
you were saying. I mean, is there anything else that's missing from the data that you don't provide or anybody else because of certain other limitations that you'd like to see?
I think that there are other measures that would be important to also show. things like the number of tests per province aren't shown on a daily basis. They aren't publicly available. And so while we can look at measures such as test positivity rate and compare cases versus tests on a national level, we can't do that, at least with publicly available data. We can't do that on a provincial level. And I think that's something that's quite important to get. I think the other measures such as the hospital numbers and different regions and provinces are important in their own right, but also to understand how the measures that we this pandemic, how they influence the healthcare capacities and access to healthcare. And so I think more complete hospitalization data would go a long way.
Okay. You made the point that you are restricted in terms of time and pressure besides your normal job in terms of when these results come out. Now, at the moment, virtually most nights it comes out about, in South African time, 9 p.m., 10 p.m., 11, sometimes even midnight, and there's been odd occasions at 1 o'clock. So when do you get those results before it's official, and then how long thereafter do you turn it out to the public?
I get as the rest of the public and the nation receives those numbers. So as soon as they are publicly available, I making use of I take those numbers and generate all the graphics and visuals on a daily basis. I do is to turn those numbers into graphs as quickly as possible. And I share them. 10 minutes of those numbers become publicly available. Those particular numbers are released at various times during the day, or at least during the evening. There have been days where I've had to wait up well past midnight to actually receive those numbers, and then to create those graphs and share them. So there's no, I don't receive those numbers before they released. I receive time, and there's no particular time. So that's one of the challenges, is to wait for the numbers whenever it does happen, and then to do what's necessary.
Okay, and then do you have the ear of the Minister of Health or the Ministry or the National COVID Command Council in terms of now relying on your statistics as you rely on theirs?
No, not that I'm aware of. My personal capacity, while there has been interest from various media outlets, I'm not contributing to the ministerial decisions or the council. So this is in my personal capacity and does not influence any
Okay, having
decisions.
said that, I think it certainly made an impact enough for myself to take a massive interest in what you do. So after the stats comes out by the Minister of Health, the next important tweet that I look out for is yours. And if it's later than 10 minutes, yes, I'd rather get worried and disappointed that there's something absolutely missing. So well done to you, right? Perhaps the last thing for you is, based upon this, because I mean, this is outside your normal job, as you said, is there any other statistic around social impact that perhaps you need to start looking at again, doing outside your day job, because you now realize that it's providing a service that people really need, and even maybe outside of COVID-19 completely?
Absolutely. As I've seen first-hand experience, I've seen the importance of the statistics and how we make use of the data. And it's something, of course, because I've not had experience with prior, I've not been aware of it. And analyzing data for COVID-19, I think it's important so for various other measures, and make use of the numbers and the data and the scientific understanding of that to inform various decisions. I think in my personal capacity right now, I am pretty much at capacity just dealing with COVID-19. I would, of course, like to be more involved in various other data and handling thereof and initiative. It's not something that I've considered at this point, but of course, if the data is available, I am comfortable with working with numbers, and so willing and happy to continue doing such for various other initiatives.
Okay, well, for now, the all-important Twitter handle that you need to be following is Ridhwaan Tweets, and it's RID. Then the one is the number one, Ridhwaan Tweets. So follow him, because he adds important data to the national, and I would think international conversation around COVID-19 trends. So Dr. Ridhwaan Suliman, great chatting to you. Thank you for your time. It's been most enlightening having this thought leader discussion with you.
Thank you so much once again for having me.